Thank you. If I can have my panelists come on screen for me, and I will get started.
Hello, hello. Oh, one second. There we go.
Awesome. Hello, hello. Welcome. All right, so let's get started. First of all, I would like to just thank everybody for taking time out of their evening to come spend time with us to talk about breast cancer. It is October, and we know how important of a message it is for us to have this conversation tonight. So thank you for taking time out of your day to come and talk with us. So we are so glad that you can join, and we are promising, hopefully, an inspiring and enlightening session today. Today, we'll be delving into the subject that is both a rare and significant conversation: breast cancer in young individuals. Breast cancer, as many are aware, frequently is linked to older age women. However, it is crucial to acknowledge that younger women also can be affected by this disease. And although such cases are uncommon, they bring forth distinctive challenges and inspiring stories of resilience that warrant our attention, advocacy, and empathy. To provide us this evening with a quick expert overview, we are honored to have with us Dr. Sheryl Gabram, a distinguished surgical breast oncologist. Dr. Gabram has dedicated her career to advancing breast cancer treatment and research. Her insights into the complexities of young breast cancer cases will help set the stage for the discussion that we are having today. Dr. Gabram's comments will continue to help us navigate the story that will be shared by our special guest, Theizu Telewoda. Theizu is a senior leader in the music and digital industry, where she has spent over a decade shaping global strategy, audience growth, and revenue innovation. As a breast cancer survivor, she shares her journey with authenticity, highlighting the resilience and perspective it gave her both in life and in leadership. She is passionate about building supportive spaces that prioritize both professional success and personal well-being. Through her story, she hopes to encourage others to find strength, adaptability, and meaning in the face of life's challenges. Thank you again for being with us this evening, and we hope you find the session to be both informative and inspiring. Let's begin by first hearing from Dr. Gabriel, who will provide us a comprehensive overview of the rarity of young breast cancer cases. Afterwards, we'll have the opportunity to delve into Tezu's personal story and learn from her invaluable experience. Dr. Gabram, take it away.
Thank you so much, Jalicia. It's a pleasure to be here this evening, and I want to extend my thanks, my personal thanks to Tezu for opening up and sharing her story. I am a breast cancer survivor too. I'm a 14-year breast cancer survivor. It took me 10 years to talk about it publicly. So I really thank you for sharing your story with us tonight. So just a few very, very quick slides. This is going to be an interview with wonderful Jalicia. So just a couple of slides. Oops, we went blank. There we go. Okay. I'm going to escape and go back to the first slide. Don't know what had a little misdirection there. There we go. These are general trends in breast cancer incidence. We are still seeing a 1% increase per year. So 316,000 women will be diagnosed in the United States with breast cancer. The rise is a little bit steeper for younger age women, here less than 50, 1.4% per year. So why is this happening? Well, it's hard to explain. We can't pinpoint it on any one particular thing, but we know that having excess body weight, not having children, because a lot of us are choosing careers and then putting off having children until later in life, or having a first child after 30 increase the risk for some of that young age breast cancer. So here's some key data about breast cancer in young women. As Jalicia mentioned, we have to put it in perspective. So these are breast cancer cases, the incidence per 100,000 women per year. And you can see that in less than 20, it is a very, 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 very rare beast. 1 to 2 patients from 20 to 29 per 100,000. That increases to 25 per 100,000 for incidence in the 30s. Now you can see how it really jumps, and this is why we start screening in the 40s. 100 women per 100,000, or in 50 to 50, 59, 250 women per 100,000. So it is not common. I also want to share with you some statistics from Maryland. Thank you, Michael Desjardins, our data science person who works with us. He's a spatial epidemiologist. And he gave me this slide and share it with our community advisory groups this month. So these are absolute numbers, not incidents, absolute numbers of breast cancer cases in Maryland over the years 2010 to 2022. And you can see young age, which we typically define as less than 40, honestly. It looks like there was a little bit of a rise there, but in Maryland, it looks like it's been fairly stable. But this only goes to 2022, not 2025. But I want to remind folks that, it is common and more common in other age groups. Look at this rise we're seeing in older age breast cancer in women in Maryland. Now, this could be because of the aging population, but I also say at the other end of the spectrum, we cannot ignore our screening mammography guidelines and raising awareness for breast cancer symptoms. Last statistic slide. These are graphs, lines of death rates, female breast cancer death rates. Again, starting from 1975, where you can see for Black and white women, the Black women is in the light pink, the white women is in the darker pink. There was no disparity or difference in breast cancer mortality, but something happened in the 1990s. And I can say that this started with the emerging technology, the use of mammography, and not all women had access to that. That was the start of it. And that has continued. While breast cancer survival is improving by decreasing death rates for both Black and white women, there's still this 30, 40% gap in difference in survival between white and Black women that persists today. Even though this is 2020, sadly, that still persists today. And so that's why we want to talk about this openly, so we can make sure that we can do better and get patients not only screened, but then get them the treatment they need in a timely fashion. 3 quick tips here about eating healthy, which is one of the pieces to reduce breast cancer risk. Eat more fruits and vegetables, avoid red and processed meats, stay away from alcohol as much as possible. I know sometimes we don't want to hear that, but we need to stay away from alcohol as much as possible. So thank you so much for that, for allowing me to introduce that. And I look forward to hearing Theizu's story.
Thank you so much for those statistics, Cheryl, and we appreciate your insight. Audience, just so that you're aware, this interview is going to be mostly around Theizu. However, there will be moments that we will tap in with Dr. Gabram to get a more medical or clinical side of things, something that we don't expect Theizu to have right this moment. So Theizu, it's all about you right now. Hello.
Hi, everyone.
How are you?
Good, I'm pretty
Good.
good.
It is so good to see you on our screen today, and we
Mm.
are so grateful for you sharing your story with us. And so with that, every story has a beginning. So can you share with us the moment you were diagnosed and what your initial thoughts and feelings were? Because, wow.
Yeah. I guess my story is a little unique to the conversation, but also very helpful to the conversation. Essentially, I found a lump on my own, like a few months prior to getting diagnosed. When I kind of started with my primary doctor because it was just kind of like, what's going on? So she checked me and, referred me to go get an ultrasound because I was still very, very young. So just for the room, I think at the time I was 27. I just turned 27. So I found it in that April. So I went to, get the ultrasound. I met with a breast surgeon, and from the ultrasound and the way that it felt, everybody assumed that it was benign. So it was more of like, do you want to just get it by right? I see you, doctor. But everybody, because it was very defined, and they were like, do you want to just like, crazy enough, one of the options that they gave me was like, do you want to leave it and we monitor it? Would you want to just get a needle biopsy, or do you want it to like completely remove it and biopsy it? So being 27, I was like, this is going to drive me insane. Let's just remove it. So I had it removed and kind of went about my day. thinking about like, this is done. They're going to call me. It's going to be negative. So fast forward a couple days later, crazy enough, I'm at work. I went back to work. Yeah, because I didn't know. So I went back to work, and I will still remember that day. I think I still have the voicemail of her calling me, and I missed the call. And she was like, "Call me back." I called her back, and that's when she told me that the results had came back, and they had found cancer cells on the tumor. So that very next day, she kind of ran me down to tell me like, this is what you're gonna do. You're gonna come in and we're gonna have a conversation about it. The initial feeling, to be honest, I felt like one of those scenes out of a movie where everything was moving like quickly and slow at the same time, because I couldn't believe it. And I'm in the office, so I'm like running around, but like trying not to like alert anybody to like the news I just received. So I wrote everything down, and to be honest, the moment that actually sort of like broke me was when I had to call my mom. Like, she was like, "Hey, do you want me to call your parents?" And I was like, "No, no, no, I'll call them." And I still remember to this, like, calling and my mom being like, "What?" Like, she couldn't really hear me because she was out. And I remember hearing the phone like drop. And I think that is the moment that sort of it started to hit home as to like what was going to be happening in my life at that time.
Right. Oh, that has to just a world shift, especially because you're in the middle of your regular day, you're just living life regularly. And
Yeah.
then also to have that reassurance from everybody, kind of like, it's probably nothing. It's probably
Yeah.
nothing. And so kind of, do you feel like, I guess in that experience, that being young, that maybe your diagnosis was just kind of perceived a little bit different and you were handled just a little bit differently?
Oh, 100%. I think, I mean, just from the beginning of the whole situation, like no one seemed to think that it was anything, but it was interesting. Me and my mom kind of laugh about it to this day. I had went to one of my chemo appointments, and I think it was like first or second. I didn't know, because again, you're just learning the whole scope of everything. So I didn't have my blood work done prior to coming in. So they were talking to me to get rescheduled. And at this point, I had left my oncologist office and I was talking to the nurse, but the nurse was not talking to me. The nurse was talking to my mom. And I've noticed, and anytime my mother was with me and we were meeting a new group of individuals, they did not speak to me. They always assumed that it was my
Oh,
mother, because they were like, "Oh, she's too young." So it was one of those things we kind of like laughed about, because it was just like, my mom would say yes and like shake her head as if whatever, and we would just kind of walk out and chuckle about it. But it just goes to show that that's not common, right? So people didn't even really speak to me at all.
which is like, you don't want to think people were being rude, because
Yeah,
they were just,
they,
operating in something that they already understood, which
exactly.
probably the older woman rather than the younger woman here. And so I can only imagine that kind of, hello, it's me over here.
Yeah.
So shifting over to Dr. Gabriel, what are some early signs and symptoms of breast cancer that young women should be aware of, since mammography is really not something that's recommended for a young woman?
Yeah, I'm glad you brought up mammography, because a lot of people say, well, if the incidence is increasing in younger age women, why don't we lower the screening rate? But remember, mammography screening has risks and benefits. And when I showed you that it's not that common in younger women, there are harms to mammography screening. In fact, during my career as a breast surgeon, we quit offering very, very high risk women in their 20s mammograms. We will only do MRIs and only start mammography starting at 30, because it is radiation exposure. So
Hmm.
signs and symptoms. So really, Theizu, I'm so glad that your doctor didn't ignore you. Giving you the option to watch it. I used to tell my young patients who I saw over my 25 plus year career as being a breast surgeon, if a doctor or healthcare provider says you got a lump and it's not there and it's nothing, go find someone else, get a second opinion. So I'm really glad your doctor didn't ignore it. And it's appropriate to get a needle biopsy. I'm glad that you just said, you know what, I don't want this bothering me. Sometimes if we can get the diagnosis on needle biopsy, though, it can affect how we're going to make our, decisions in the next steps. What are some other findings? Sometimes you can only have a lump under your arm and not in the breast. And that's called an occult breast cancer, where you get a mammogram and you can't see it, but it presents as an axillary lymph node where there's breast cancer already underneath the arm. There can be swelling of the arm, of the breast rather, that looks like an infection. And this is tricky because most red hot swollen breasts, it's an infection. But if your primary care doctor puts you on an antibiotic for a week or two and it doesn't go away, go see a breast specialist like you did, because that could be inflammatory breast cancer. It's very unusual in young women, but still, that could be inflammatory breast cancer, very aggressive. Dimpling, some puckering, that's the breast cancer growing along the ducts, that can happen. Areolar kind of eczema or rash, flakiness, that's Paget's disease. That's a sign of breast cancer. Nipple discharge, but it has to be a certain type. One side, spontaneous nipple discharge, bloody, clear, yellow, and you wake up in the morning and it's on your nightgown, that kind of a thing. It's not when we compress after we've had breastfeeding experiences, not multiple ducts, multiple colors, but spontaneous nipple discharge. And then one more sign, focal breast pain all the time, not cyclical breast pain. Jaleesa and I were talking about this today. Oprah did a special when I was practicing in Chicago about how rare, how breast pain can maybe be a sign of breast cancer. I had everybody coming to my clinic then. It's breast cancer that persists in one place all the time over a cycle or two. Some women, but it's a really unusual sign. So those are the major signs and symptoms. And I am so glad that your doctors just jumped on it and that you were diagnosed and you were started in treatment.
Thank you, Dr. Gabram.
Mhm.
So speaking of having awesome doctors that were able to just jump on it, Theizu, have you ever, prior to, your finding of the lump in your 27 years of living, have you ever talked to your doctor about your potential breast cancer risk?
No, at all. Like there was never a conversation at all. And interesting enough, it's in my chart, right? Like for me, it is genetic, which I found out, which is part of why I also feel like women should definitely talk to family members for sure, because it wasn't something that I found out probably until like a little bit later in life, and just kind of having a conversation with my dad about how did his mother pass, and that was when I found out. But I didn't find this out until I was in my like late teens. So, but to say is once I did find out like late teens, early 20, I did start to mark it off on my various doctor forms and things like that when I was my intake forms, but never once was there a conversation around it. And given the history and knowing that, my grandmother passed young, like that, but it also wasn't a thought in my mind, right? Because,
Right. And I
right.
don't think many people do take time to think about it. We learn our family history, but I don't
Hmm.
think that we've realized how to apply that knowledge when it comes to our own healthcare. And so I know that one of the new recommendations now, especially for Black women, is that at the age of 25, you should start talking to your doctor about what your risk looks like for breast cancer. This is not saying you should go get a mammogram. This is not saying that you're going to have an MRI. But at 25, it is now recommended that women of color start talking to their doctor, because I think we have more instances of it running in our family and then us not talking to our family about it happening.
Yeah, I mean, I wish that information was out for me to start having that conversation at 25. Because I think my decisions and the things that kind of followed after that may have looked a little bit different. And especially once getting genetic tested after finding out that I also don't have BRCA1 or 2. I actually have PAL-B2, and that's not something that they talk about, right? It's not something that people know about. It's on the lower end. So I think had I known, and maybe they did run blood work, but they didn't see the BRCA gene or something. So maybe that's why, I don't know.
Mhm.
But I wish that that was something that was advised, or at least looked at, or a conversation had started around 25, because
Yeah.
probably if I knew I had the gene, maybe I would have done more elective and like preventative stuff versus having to be reactive to it.
And that's understandable. And I think that is exactly why we want to have that conversation, because having that conversation opens the door to have genetic testing before you're diagnosed. And
Mhm.
that kind of can help, like you said, make a decision in how you guys are going to navigate. And
Mhm.
so, Dr. Gabram, can you offer some guidance for young women? Like, how should we communicate our family history and our personal health to our healthcare provider?
So I'm so glad you brought up the idea about the 25-year-olds, because this was just a recommendation by the American College of Radiology in May of 2023. So you're right, Theizu, it's only been recent that, they have also said at age 25, Black women and Ashkenazi Jewish women, because Ashkenazi Jewish women are at higher risk for carrying the BRCA1, BRCA2 gene, that they should have that conversation. And there are risk assessment tools, the Klaus model, the Gale model, based on your family history, based on, have you had breast biopsies? It's not the breast biopsy, but it's the activity of the breast that might put you at risk for developing breast cancer. Have you ever had atypia on that breast biopsy? What is the age that you started having babies? Did you breastfeed? All those things combined can give a personalized risk of, what is your lifetime risk? PALB2 has about a 25 to 30% risk of developing breast cancer over a lifetime. And you're right, at 25, there were, screening modalities that could have been done. We would have possibly offered MRI once a year in someone who carries that mutation if you have a greater than 20% lifetime risk. And again, just breast self-awareness that we talked about. So the family history, I'm so glad you pointed it out because, and especially the dad side, you are making so many good points tonight because most of the patients who would see me about family history when they were high risk gave me histories on their mother's side. But it affects when we start screening. So if your dad's sister or your grandmother was diagnosed with breast cancer at 40, we're going to start 10 years early. And so you're going to start screening at 30 years of age. So that is so important to have those conversations, not only breast cancer, but ovarian cancer risk that's tied with the BRCA gene. So talk about it, be open about it. Don't hide this stuff. These are life-saving things that we can all offer each other. Now, having said that, I want to make this point. 60 to 70% of all women diagnosed with breast cancer do not have a family history, even for young women. So that's why, again, paying attention to the signs and symptoms, alerting somebody and get it taken care of quickly is important.
Very important. And those conversations I've been places where people have the conversation at Thanksgiving, hey, what happened to our family? Who this person, if that's the only time we can get together. But I do think we need to break the stigma and remember that your doctor's not there to judge you. They're there to help you make the best decision for your health. So making sure that you're honest is important. And so Theizu, when we were entering into treatment, what was your mindset? Was it positive? Was it negative? Was it all over the place?
Yeah, it's somewhere all over the place and maybe not the most positive, I will definitely say. I tried to prolong it. Like they wanted me to go in for surgery earlier. I tried to prolong it because I think I was still also in that very much of a denial phase. We started with I did a bilateral mastectomy first so that they can put the port in to get me ready for chemo. And I just remember like the day going in having, I think that's when it became real that morning, like having like the worst anxiety attack I've ever had in my life, to the point like the nurses were trying to like calm me down because I think for a while I tried to just pretend that it didn't happen because I think my frontal lobe was barely developed, so I didn't really know how to process some of this information or something this traumatic at that age, especially if I at that time hadn't had major traumas or anything that has happened to me. So yeah, going into treatment, I think starting the process was very difficult. I think once I got the surgery and kind of was heading into the chemo part of it, I think at that point is when I was like, all right, I'm on this journey now. So, I kind of buried my head in the sand and just like dug my feet in and just did it and went with it. And it was hard, but here we are 9 years later.
That mindset shift kind of came out of like, look, I just got to do this. It's got to be done.
Yeah. At this point, yeah, I was just like, I've had this surgery, this massive surgery. This port is going in. I'm not going to walk around with this port in without going through this process. So it's going to happen.
It's going to happen. And so what would you say were some of your biggest challenges you faced on your journey, both physically and emotionally?
Yeah, I mean, I think with cancer, especially like breast cancer, I'm sure any cancer period, you think until you know, right? Like people may have had family or a friend that goes through it, and, but until you're in it, I think that is when you don't really fully understand the challenges that come with it. I think emotionally, like I said, I try to ignore it at first. And then I think even with me kind of putting my feet down in the sand and going for it, I was definitely like numb. And still trying to stay very strong for everyone else. I can't imagine as a parent, having to watch your child go
Yeah.
through a thing. So, you're still trying to present yourself a certain way, even though internally, like, you don't even really understand what's going on. You're experiencing the physical aspect, the pain of it all, the body changes, the hot flashes, losing your hair. Um, and then just and it's such an interesting thing. I tell people it's really like a cycle. I was on it every 3 weeks. I had 4 rounds every 3 weeks, and it was like that first week was like brutal. I always equate it to like the first trimester of pregnancy, like where you're just like, I am sick,
Out
I
of it.
hate it, out of it. And then like, the second one, you're like, oh, okay. And then like the third one, you're kind of in this space of like you feel okay, like, but you're mentally starting to gear up to go back through another round of it again. So I think it's just that emotional roller coaster constantly. Like you'll have these glimmers of like where you feel normal,
Yeah.
but it's not. And for those that have came after me, like I kind of equate going through the process to like a very interesting bus ride adventure. Like you kind of get on this bus and you do this thing, and then they drop you off, and like the doors of the bus close. Like it's like that Wild Wild West scene, and then
Yeah.
they drive off, and like granted, everybody's there and they're cheering for you and they're so happy you made it, but then you're like, I actually don't know what to do with
Yeah.
myself.
It
Yeah.
sounds like you went through the different stages of grief.
Literally.
Yeah, it sounds like, you're like, "Look, I don't wanna do this." You denied the whole thing, and
Yeah.
then you were like, "Okay, I'm gonna do this, but I'm gonna do it kicking and screaming." And, and then it's like, "Okay, it is what it is." But then, like you
Mhm.
said, you still might go back into those moments of, "Why? Like, why is this
Yeah.
happening?" And so,
Yeah.
did you ever feel like being diagnosed at 27 years old, like, life hadn't even really started happening yet? Did you ever
Yeah.
feel like you potentially could miss out on anything and that there were things that you just might not get to experience now that you had cancer? And whether it was true or not at the time, but did you
Yeah.
have that thought?
Yeah, I think for sure. I feel like being a young breast cancer survivor, but at the time patient, I feel like again, especially if you're not exposed to it, you don't know what life could look like after it, right? Like for me, the closest of kin was a grandparent that had it and she passed, never got to meet her. So like here I am now, like she was young, I'm young. I don't know what this looks like for me or what this is gonna be. I definitely felt that way. And then I know I wasn't sometimes in the best of headspaces to the point where at one point like I declined like freezing my eggs because I didn't know what was gonna happen. Like they were like, "Do you want to do this thing?" I'm like, "Why?" Like if I'm not here, why spend the money on this? So I think when you're young and it first happens, especially then, I think there are definitely more conversations now, and there's definitely more resources now, and because of the boom of like small like social media and things of that nature, I feel like people are seeing it. That wasn't what my algorithm looked like back then,
Yeah.
so I didn't know what life could be after, so I did feel like I was going to be missing out on a lot, and all the things that I had planned I felt like had to stop, and I didn't know if they were going to continue.
Yeah, that's a rough kind of blank space to be in. You're kind of just staring into the abyss of,
Mhm.
I don't know what's gonna happen.
Mhm.
And I know that that had to be just the most challenging thing. And so, how did that change your life in terms of your
Mhm.
career, your relationships, and your personal growth? Because like your relationship with yourself had to shift majorly.
No,
So,
yeah, I shout out to therapy, because I think it's and I didn't realize it was trauma until somebody put it that way, right? Because I think I lived in this weird little bubble of trauma was, abuse or these things or whatever, not necessarily going through cancer. So my mindset initially coming out, like I said, you kind of dropped off into this like desert and you have to like figure out how to rejoin society now as this person. And as you're getting healthier, you know, the further it's on people's mind that you went on this thing. So people talk to you normally and like they're doing these because they're like, oh, she's good. And it's like internally, I'm not. I'm having these
yeah,
anxieties. Like, is that a pain? Like, is that this? But I think in terms of like my career and relationships and like personal growth, I left my job slowly after because I had this like carpe diem, like seize the day, new lease on life after. Um I was like in a relationship and I was dating someone at the time and like got married and sometimes I wish I would have waited maybe till for us to get married just because I feel like that year after was so emotional. And I know it was already an emotional ride for the both of us and then I'm still trying to process those things. So And then just my personal growth, like I will say it forced me to live maybe a little too much on the edge because I had this like you never know what's gonna happen type of mentality. And but because I feel like when somebody gives you a potential end date to your life, like you kind of start to feel like I have to get off the shelf and and like I know what I'm dealing with and like what I'm not. And because of that, I think I started to take food, fitness, a lot of the things that Dr. Graham had mentioned. So I was already a pretty healthy person, which is why also the diagnosis was so shocking because I was fit, I worked out all the time, but I think I started to take it from a different perspective instead of the physique, it became more of a lifestyle and making sure that I'm healthy and eating the right things and being more mindful and but going after it kind of gave me this new sense of freedom to be more of who I am. I think I'm in a space now where there's really nothing that anyone can necessarily tell me. I feel I found this weird confidence after going through like everything and just kind of being like, yeah, you are who you are and you're here for this reason. So live, like get off the shelf and live.
I love that saying, get off the shelf and live. I think you should write a book. And 5%, just so you know, just gonna throw it out there.
I got you. I'll get your share.
But it really is a testimony to get up and live, like, do what you're supposed to be doing for yourself so that your tomorrow self can be happy no matter what you end up facing. And so I think that is just such a profound statement to make. And I have a bonus question to add on here. When you were seeking your treatment, did your providers offer any clinical trials or any special treatment or anything that was outside of the norm of what people think? Like you had a double mastectomy. Anything else did they offer?
They did bring up some of it in the conversation prior to like waiting through for me to get through a bunch of testing because it wasn't necessarily around like the clinical my biggest thing was losing my hair. So I was just like, what can I do? I mean, they talked about like cold caps and like various things that were helpful, but I also am one of them people that I'm like, if I'm gonna do something, I'm gonna do it big, baby. Like I want to experience it. I'm like, no, let me get in there, like, and experience this. And because I'm like, I'm very like, what good would it do if, regardless of me putting a cold cap on my head, and if I lose my hair, I lose my hair. So there weren't a lot of talks about like clinical trials and things like that. I think because it was essentially almost, I don't want to say cut and dry because this is never cut and dry, but just being stage 1A, having a high oncotype and like those things. I think they felt like they had a sort of cocktail that would work. So
Yeah, it does sound cut and dry, for lack of a better term. But so Dr. Gabram, are there any latest advancements in breast cancer treatment for young patients, and do they impact survival rates or quality of life?
It's a great question, but before I answer that, I just want to comment on your healthy living attitude, because when we talk about risk reduction, and I like that today in Dr. Brawley's class, instead of prevention, we can't always prevent cancer, but we can reduce risk. All the healthy things we are taught to reduce the risk of maybe being diagnosed with cancer, it works for recurrence. So you are doing the absolute right thing in terms of eating healthy, exercising, because that decreases the chance of it coming back just as good as all that therapy that you went through, by the way. So again, kudos, keep it up, and you're wonderful. You're my hero. Okay, so what are some of the advances? Well, the precision medicine that you talked about, and you had that back then. We were doing the testing on the tumor. So there's tumor genetic testing. Now that's called somatic testing, as opposed to germline testing is when we test individuals to see if they have a gene that puts them at risk. The tumor genetic testing is they take the tumor and they test it and they find it. Is it ERPR positive? Is it HER2 positive? And because you had the Oncotype DX test, then that meant that it is a hormone-driven cancer, and they're going to give you specific drugs for that. So MammaPrint is another kind of a specific test that they can do. And so more personalized approaches really lead to better survival. Targeted therapies too. If a tumor is HER2 positive, there's drugs. Trastuzumab is one drug that is targeted specifically for those people who are HER2 positive. Triple negative breast cancer patients now may benefit. The triple negative means the estrogen is negative, the progesterone is negative, and the HER2 neu is negative, and they can benefit sometimes from immunotherapy or this is why I'm a surgeon, not a medical oncologist. Pembro, we'll abbreviate it, Pembro, for immunotherapy plus chemotherapy, okay? PARP inhibitors is another group of drugs. If the woman has germline testing and she gets diagnosed with breast cancer and she's BRCA1 or 2 positive, the PARP inhibitors, oliparide, can benefit patients. So that's why it's a combination of germline testing and somatic testing that can get the best decision. We had a lot of those things 10 years ago.
So Dr. Gabram,
Yes.
should we just, as a patient, should I just go to my doctor and request these tests?
So in terms of germline testing, that's where the family history comes into place, where your primary care doctor will say, did you have a grandmother on your dad's side? In fact, I'm very proud of a program that we implemented in Georgia, in all of the public health clinics. Women can walk in there and do a quick screen test with the public health nurse to find out if she qualifies for that actual blood testing. And this is before you're even diagnosed, okay? This is before you're diagnosed with breast cancer. So I'm so proud of that program. We're trying to bring it here to Maryland, by the way, and it's going to happen and we're going to get it. But that's the germline testing, okay? And it is recommended for breast cancer patients 65 or less now. If you're diagnosed with breast cancer, get that germline testing. And even when I throughout my career, that was not the case. So we are doing this genetic testing. And it's not only for the BRCA, like you said, Theizu. There's like 15, 20 genes that are tested for now. ATM, PALB2 are some of them. And that, then, if you have that genetic risk, but it only counts for 5 to 10% of all people diagnosed with breast cancer. I liked how you talked about fertility preservation, because I'm glad that you were offered that, because again, now it's more common. We're talking about 10 years ago. Would insurance pay for it? Did insurance pay for yours?
That was part of it. At the time, they were very like, we can write it up, but if like one thing's wrong, then it might not go through. So that's why I was like, you know what? I'm not even gonna take the risk. Like, I need to spend this money on like my health and my care first.
Yeah.
But yeah, so our insurance at the time was not the best. It was kind of spotty. Yeah.
Did
And
you ever
again,
go back and try?
I did actually, funny enough. I guess side by story, I went back and tried last year, because of the cancer, my egg reserve is obviously a little bit lower than a lot of folks my current age. So I did it, but then fast forward a month after putting my eggs in the freezer, I ended up pregnant. So I now have a baby boy. Yes.
Yay!
So
that is incredible.
9 months later, I have I mean, 9 years later, I have a baby boy. So yeah. Mhm.
So
Is
you
that,
had,
I'm sorry.
yeah,
Yeah.
I'm sure you had to have that conversation with your doctor and the
Yeah.
timing of everything.
Yeah.
But oh my gosh, congratulations. That is
Thank
so
you. Thank you.
fantastic. That's so
Thank you.
fantastic. Other advances, when we do breast conserving surgery, sometimes we can do oncoplasty, move tissue around so you don't have a huge dent. If you elect for the mastectomy, then there's immediate reconstruction that we can offer. A lot more psychological and supportive care, oncofertility counseling, tailored psychological counseling, sexual health services. Some of the drugs and things can cause sexual, issues. And so there's a lot more counseling and awareness about that now. Peer groups are increasingly integrated, kind of standard of care for, young patients. We talked about the genetic testing, clinical trials access. There are more clinical trials nowadays than 10 years ago, even for younger women. And I like your aggressive approach, though. And obviously safety, but aggressive approach. In the end, the 5-year survival has really continued to improve for, all subtypes of breast cancer, for young breast cancer patients, especially with these targeted and immunotherapies. And speaking of the quality of life of the treatments, I know it sounded like you were, again, a warrior in going through these treatments, but there are a lot more drugs that can sometimes eliminate the side effects these days. And the other thing is, we're trying to dial back. In fact, I learned this from a group of women with metastatic breast cancer. There's a whole association out there. You know, why do we need to be on such aggressive therapy when quality of life is important? So it got the oncologists' eyes and ears, and there are studies being done to try and de-escalate not only chemotherapy, but immunotherapy, radiation therapy. So less is more sometimes, as long as it's safe. Okay, we have to keep it the standard, but now there are clinical trials that are looking at maybe we can get by with less.
Thank you, Dr. Gabram. And so Dr. Gabram made a mention of like support groups and peer groups. Did you happen to join any of those, and how did they benefit you if you did join any?
I did sign up for some. I think it was kind of tough when you're going through treatment at the time to stay consistent when you're kind of all over the place and a little bit tired. So I will say I wasn't like the most like committed to it. I did start to follow like more communities on like Instagram and other like social platforms. That was probably a little bit easier. I'm scrolling to kind of just see other people's stories or like get a good laugh from it. But I will say for me, like my friends and my family definitely are the ones that carry me through this journey, you know, like just from home cooked food, like healthy meals when the days that I can. And for me, I had the urge to feel normal as possible, despite being, you know, not having a normal 20-something life. So I kind of told my friends, like, still invite me out. Still, if I can come, I will come. So I kind of tried to be as active, but safe, because it was also during winter, cold and flu. You gotta be prepared during that season because your immune system is low. But so you know, doing things like that, still trying to be a part of my normal life. Yeah, like life at the time while going through treatment. So I think those things really helped me, just that village that I had around me, or like even taking me to go get like really good wigs and those things, because I had friends that were really in that space. So that those are the moments that I will never forget. And I'm so grateful for those people because it helped me get through these moments.
That is an amazing thing to have family and friends, because a support group is one thing. Yes, they understand what you're going through on a personal level as far as experience, but your family and friends know you.
Yeah.
And to be surrounded by their love is definitely, you know, whew, I'm glad that I have this soft place to land when my world seems to be crumbling. And to circle back, speaking of family, now that you're a mom, has that shifted, you know, being a warrior on this side of your cancer diagnosis, has that shifted some things for you? How has being a mom been?
Yeah, I mean, I think some days I feel like cancer might have been a little lighter than the transition of being a mom. Only because one, I think, and you know, I'm very honest with people. I was like, I didn't know if I'd be a mom, so I think my mind never went into like, I never had a mommy moment or mode where it's like I want to be a mom so bad, because I accepted that this might not be for me, especially without challenges. So, I think that has been a shift. And then as hard as I think with cancer and not having a child at that time, I will never take away from like the journey. I can't imagine people who do it with children, because at least I was able to focus on myself at the time. So being a mom now, I will say that I think a lot of my experience and how I persevered, but also the things that I've gained from that, just kind of the patience and like the releasing of control and things like that, has helped me in this parenting journey so far. I know I'm very early into the stages, and I know it has its stages.
Fun.
But yeah, that's what I keep hearing. I hear that it's so much fun. But no, I mean, it's been a joyous experience to even see, because this is something that I didn't think that was happening. So I feel like I'm really learning momminess for the first time. And like, you know, your mindset does shift. And I think what it does is I remember like I've done hard things. So I feel like to be a mom and the days that it is hard, it's like, girl, you made it through cancer. Like you went through 4 rounds of chemo, a double mastectomy, breast implant. It's like you went through all of this, and it's like this little baby is not going to
They won't. It feels like it. I know it does. However, I always have to tell myself I have beaten one. I am 100 and 0 to my bad days. I have
Right.
every single
Exactly.
bad day or bad moment.
Exactly.
And I think that is a token to keep pushing forward.
Exactly.
And so I have a couple questions in the chat.
Okay.
I think they're going to be a little bit more technical. So Dr. Gabram, they're
Okay.
going to be towards you. But before we get there, Theizu, I would like for you to offer what word of advice would you give to young women regarding their breast cancer awareness and their body awareness?
Yeah. I mean, first and foremost, always check your breast. Do the screenings at home or yourself. But I would say you are your first advocate, you are your first star player. So it's like, trust your body. If something feels off, if you've been living in that body for an extended period of time, you kind of have a general sense of your good feeling days physically and your not so great feeling days. And if things are prolonged or you find something or you feel something, do not hesitate to reach out to a doctor, a specialist, whoever you need to. Just don't ignore the signs. Like if something doesn't feel right, no one's faulting you. Go and ask the question. If it's nothing, it's nothing. But I'd rather you know it's nothing than for it to be you think it's nothing and it's something.
Right. That is a huge one. And
Yeah.
doctors are there to help us. And while no, we don't want you going to the doctor for every little ache and
Right.
pain, but know your body,
Right.
You're in the shower, you're washing up anyway, you should know what they feel like,
Right.
and know what feels normal and when it feels normal. Ladies, it's really important to know that, especially young women, that your breasts are going to feel different depending on which part of your cycle you're on. And a part of knowing your body is kind of feeling that over a period of months. So you know that, oh, my period's about to come on. This is how my boobs normally feel, or they're normally sore. And you don't go thinking that pain means breast cancer, like Dr. Gabram said earlier. So just making sure that we're aware of our bodies. So I'm going to tap into a couple of these questions. It says, I'm a 71-year-old starting getting mammograms at an early age. They have shown no evidence of breast cancer, but scattered areas of fibroglandular density, and there are benign calcifications present. At what age do I stop getting tomosynthesis projections with 2D imaging?
Okay, so tomosynthesis is really the 3D mammogram. The analog is the 2D. Analog means two views, thank you, ma'am. And if it got a little blurry, they had to come back and do it. Now with the 3D, they do it with computerized. And so they can manipulate the images and you don't have to get squished again multiple times necessarily. In terms of, this is where it really gets tricky though. You have to have conversations with your doctor about how long you are going to continue your mammography. Most of the guidelines out there say go to 75, but have conversations with your doctor. If your life expectancy is more than 10 years, some doctors may encourage women to continue after 75. That's the American College of Radiology recommendations. In fact, I just read an article this past week that some 80-year-olds could benefit from continuing mammography. But it's such a personalized approach and decision because, again, you have to have that 10-year runway because otherwise you don't want to screen for something and find something, that you don't really have to treat. On the other hand, cancer in older women is often estrogen driven and sometimes can be just treated with a pill. Sometimes doesn't even need surgery. So we can even really back off in terms of treatments. So I'm very much in favor is have conversations with your healthcare provider about when you should start and when you should stop mammography.
Thank you for that. The second question says, if you have the BRCA gene and get a double mastectomy, are your risks for cancer gone, or could that cancer become somewhere else?
So this is someone who has never had cancer, right? You're high risk for cancer because of family history. You went and got genetic testing. You find out you have the BRCA gene. You're getting monitored, and you decide. I give a whole talk about kind of the spectrum of care options, and at that far end of the spectrum is what's called a risk reduction mastectomy. But notice what I said. I said it's risk reduction. It's not total prevention. When we get a mastectomy or do a mastectomy, there is a little bit of breast tissue left. It's just you can't, as a surgeon, you can't microscopically remove every single breast cell. It's just like why men can get breast cancer when they hardly have any breast tissue. So the risk is never zero, But for a patient who's BRCA positive and decided I'm done having children and I want to have bilateral mastectomies, would also think about having bilateral salpingo-oophorectomy to reduce the risk of ovarian cancer. That's risk reduction too. Cancer can be sneaky, sadly. Cancer can show up any place, anytime, anywhere. And so nothing is 100% guarantee. Just like if a woman chooses or has to have a mastectomy and then chooses maybe to have the opposite for symmetry, it doesn't mean it'll never come back on the chest wall someplace. So that's why you have to be vigilant on the chest wall and make sure you don't have any lumps under the arm or on the chest wall, just as if someone had breast conservation therapy.
Thank you. And the last, this is more of a comment, and it says, I very much enjoyed this entire interview. Dr. Gabram's very knowledgeable, yet kind and relatable way of delivering such complex information. And Theizu's amazing story has been so inspiring to listen to. Thank you both for sharing. Theizu, I wish you and your growing family many happy and abundant years. You really are a hero.
Thank you to whoever that is. Thank you.
You never feel like the hero in the moment, but
yeah,
you really end up being the hero. And then somebody said, I second that comment. So,
oh, thank you. I mean, very much like Dr. Gabram, it's taken me a very long time to talk about this. So thank you guys for the platform.
one more thing, it's a comment to Theizu. It says, Theizu, I have had a health issue and it has made me anxious. So I can somewhat relate. Other than therapy and family help, what did you do to not overstress?
Oh, I mean, it's hard. I will say it's definitely hard. One thing, stay offline. That is stay
Dr.
offline.
Google, stay away from
Dr.
Dr.
Google, stay top 10, stay offline. Outside of like family and I think for me, I found a lot of solace in my faith, even though I questioned a lot of reasons why this was happening. But I think there was solace in that. Rest, as much as possible. And I did things like I went and got a massage. It wasn't the most comfortable with my expanders in, but I just found other ways to relax when I would find myself getting anxious. Prayer, meditation, going for walks when I could physically go, just to get out of, because sometimes when you're sitting in your house or home or wherever you are, you kind of go stir crazy, and that's when your mind really starts going. It's kind of the concept of like idle mind. So sometimes it's just breaking up that mental wavelength that you're on and finding out whatever that is. If you want to dance and sing, if that's what your thing is, if you like to go for a walk, go for a walk. But also rest, because you can't heal if you're not resting. I feel like, especially during those times with health issues, a lot of times it's our body. I honestly felt like cancer was, obviously it's genetic, but I feel like it kind of came forward because I didn't know how to rest. I was young, I was moving, and I think that was my body's way of telling me like, hey girl, I need you to sit down for a second. And I didn't listen, and then and here we are. So that's why I said listen to your body. If you need it, take it, because your body will show you signs of what you need before it forces you to.
And you did listen. I want to say
I did.
you did listen. And given the circumstances that you were a part of, you did the best that you could with what you had, especially because we're in this awkward phase of I can't really go get a mammography, and the conversation is a little bit foreign to have. I think that you really did the best that you could, and we're really grateful that you were able to find it early. It was something you were like, look, just take it out so I don't have to be worried about it. That kind of shows that you did something. You kind of took some action, even if you kind of thought it might not be anything. And so give yourself a pat on the back for doing something, because you did.
Thank you.
No problem. And I don't see any more questions in the chat. So before we go, we have some closing remarks from Dr. Gabram.
Okay, thank you again for sharing your story, Theizu. I have a few closing comments, and just to summarize everything we learned today, because your story really brought up so many important points. Know your normal and what's abnormal. And that goes for more than just breasts. We're seeing younger age colon cancer too. Educate yourself and understand your family history. Communicate clearly to your healthcare provider. Don't ignore signs and symptoms. Don't say we're too busy at work or anything. Make a point to make that appointment, and find another healthcare provider if you're being ignored. Use available resources, websites like Young Survival Coalition, Susan G. Komen, breastcancer.org, American Cancer Society have resources for connecting young women to support groups and give information to young women. Bring an advocate, an extra pair of ears. And I know, I'm sorry that they were talking to your mom more in some of those appointments, but sometimes it helps to have those extra ears, no matter who you are. Document in a journal, keep track so you can make sure you ask the right questions on that next visit. The bottom line is trust your instincts about your health. Don't hesitate to advocate for yourself, even if you're young. Persistent, respectful communication, keeping records, seeking second opinions, and using resources really can help ensure that you get the care and attention that all women deserve. Thank you again for inviting me today.
Yeah,
Thank you so much. We appreciate your comments. I'm going to put in the chat, if it hasn't already been dropped, the survey. So we do a survey at the end. We would just like to hear everybody's opinion about tonight's webinar. Did you like it? Did you love it? Is there any room for improvement? And any topics that you might want to hear in the future. So we look forward to it. So look for it in the chat. I'm about to drop it. Give me 1 second. It's not copying for me. Germinal, if you're on, can you go under surveys and grab the link for the poll? And Theizu, again, thank you so much for your time. Thank you for sharing your story with us, because it's personal and you didn't have to. And so we are grateful for the women that you're going to help in the future. And I hope that you don't stop sharing your story, because people need to hear it.
Thank you. Thank you guys for having me and thinking of me and inviting me to speak.
We just had excellent webinar. Thank you all. Great session. Good. And the link is the link is right here in the chat. So if you can go ahead and snag it out the chat, we will stay on for a bit just so that you can grab it. We appreciate you guys so much. And if you're done with us, you can sign off. Until next month, have a wonderful evening.